Our own researchers and scientists have told us that our decision to lock down the country was a correct one. They were concerned that without quick action, we were only a few weeks away from a similar situation to other countries that have been adversely affected.
The South African government took urgent and dramatic steps to deal with the spread of the COVID-19 virus. These measures are much needed for a population with such a large number of people with suppressed immunity because of HIV and TB and high levels of poverty and malnutrition. The 2018 statistics released by the Joint United Nations Programme on HIV and AIDS show that the percentage of people living with HIV in South Africa among adults from 15 to 49 years was 20.4%. According to the World Health Organization, a total of 1.5 million people died from TB in 2018 globally. The disease is one of the top 10 causes of death and the leading cause from a single infectious agent. The coronavirus could pose a higher risk to people with pre-existing conditions.
If COVID-19 attacks someone who is having another chronic condition like TB, where, the underlying immune system is somewhat compromised, it just means that, COVID-19 would be a bit more aggressive. Now, the same could be said about somebody who has HIV and perhaps have a low CD4 count and the immune system is still struggling. However, for those that are well controlled, have a very high CD4 count and no trace of virus, we're not sure what the effect of the ARVs will be on COVID-19.
Those who are living with infectious diseases are advised to take good care of their health.
I think the best advice is to really ensure that if you have a chronic ailment like diabetes or hypertension, the best you can do for yourself is to ensure that your chronic condition is well controlled currently, that if you're on medication, you ensure that you take your medication as directed.
Amid the growing numbers of infections and deaths, government has reassured South Africans that the nation will overcome this global pandemic. South Africans are expected to heed and adhere to the lockdown regulations in order to save lives. If not, we might find ourselves bearing the dire and fatal consequences. Natasha Piri, SABC News, Johannesburg.